Right now, millions of Americans on Social Security, SSI, SSDI, and SNAP are either missing money they're owed or about to lose benefits they didn't know were changing. And April 2026 is one of the biggest months for updates we've seen in years. Here's what's actually happening. Over 75 million Americans just received a 2.8% COLA increase to their Social Security benefits in 2026. But here's the catch. Medicare Part B premiums jumped to $202.90 a month, up from $185 in 2025, which is quietly eating into that raise before it ever hits your bank account. SSI recipients are now capped at $994 a month for individuals, still not enough for most people to cover rent, groceries, and medication. And SNAP? Major work requirement changes are rolling out. The age range for required work now stretches from 18 to 64, and several states, including Texas and Florida, have already banned using your EBT card on soda, candy, and sweetened drinks, starting this April. If nobody told you about these changes, that's exactly why this video exists. Stay with me, because what you're about to hear could directly affect your next deposit. Now I have all the data needed to write a thorough, accurate, conversational body script. Let me write it out. So let's start with the stimulus check conversation, because this is the one topic that has more confusion and outright misinformation surrounding it than just about anything else right now. You have probably seen videos, posts, and even some so-called news articles claiming that the IRS has confirmed a brand new $2,000 stimulus check is hitting bank accounts this April. You may have seen headlines about a $390 deposit or a tariff dividend check that is supposedly on its way. And the reason millions of Americans are searching this topic every single day is because people are scared, they are stretched thin financially, and they genuinely want to know if there is real money coming their way. So let me give it to you straight, because you deserve the truth, not clickbait. As of right now, there is no approved federal stimulus check of any kind scheduled for this spring. The last federal economic impact payments were issued back in 2021, and Congress has not passed any new legislation authorizing another round. That is the verified, official reality from the IRS itself. Now, what you may have heard about, and what is actually generating a lot of the buzz, is President Trump's idea of a so-called tariff dividend. A White House official confirmed that Trump is committed to the concept of sending Americans a dividend check, but there's still no detailed plan, and the president himself said these checks would come toward the end of the year. That is not April. That is not even confirmed at all. Congress would have to approve it, and financial experts have raised serious concerns about the logistics and total cost of such a program. So when you see a YouTube thumbnail screaming about a confirmed $2,000 deposit in April, please understand that those videos are designed to get clicks, not to inform you. There is no such confirmed payment. What there is, however, is a very real conversation happening in Washington right now. Senator Martin Heinrich introduced a bill that would give joint filers making under $180,000 a payment of $200 plus $600 for each dependent child as a rebate for the financial impact of tariffs. That bill exists. It has been introduced, but it has not passed. It is sitting in committee, and scam artists are using all of this political noise as a way to target everyday Americans with fake promises of unapproved payments, trying to steal your personal and financial information. So if anyone calls you, texts you, or emails you saying you need to confirm your bank account to receive your stimulus payment, hang up, delete it, and do not engage. That is a scam, plain and simple. Now let's move on to Social Security, because this is where the truly significant changes are happening in April 2026, and a lot of people still do not fully understand how these changes are affecting their real take-home amount each month. Social Security and SSI benefits for 75 million Americans increased 2.8% in 2026, which began with benefits payable in January of this year. Now, on paper, that sounds like good news, and it is, partially. The Social Security Administration estimates that the average retirement benefit rose by about $56 a month, taking the average from $2,015 up to $2,071 starting in January 2026. But here is what they do not always explain clearly, and this is the part that matters most to a lot of you. Medicare Part B premiums increased from $185 a month in 2025 up to $202.90 in 2026, a jump of $17.90 per month. For millions of you who have Medicare Part B deducted directly from your Social Security check, that means your $56 raise is actually closer to a $38 raise after the premium increase eats into it. And for some people with lower base benefits, the premium increase wiped out most of the COLA gain entirely. For example, if your SSDI benefit increased by $44 per month, but your Medicare premium went up by $17.90, your actual monthly increase in take-home pay was only about $26. That is the real-world math that Washington rarely talks about. They announce the COLA increase with press releases and fanfare, but they are a lot quieter about the Medicare premium hike that comes along right behind it. For those of you receiving SSI specifically, let's talk about your numbers. SSI recipients saw their maximum federal monthly payment increase from $967 to $994 for individuals, and for couples it went from $1,250 up to $1,491. That is $27 more a month for a single person. Now $994 a month. Think about that for a second. In April 2026, with rent, groceries, utilities, and medications costing what they cost today, the federal government is saying that $994 is what a single person with a disability or a senior with extremely limited income needs to survive. Groceries alone cost 29% more in 2025 than they did in 2020. So while the COLA adjustment is technically doing its job by law, many advocates and researchers argue that the formula used to calculate it, which is based on spending patterns of urban wage earners, does not accurately reflect what older Americans and people with disabilities actually spend their money on, particularly in healthcare. Your medication costs are rising faster than the COLA. Your insurance premiums are rising faster. And yet the formula does not fully account for that reality. For SSDI recipients, the average monthly SSDI payment increased from $1,586 in 2025 to $1,630 in 2026, an increase of $44 a month. Your individual amount depends on your specific work history and lifetime earnings before you became disabled. So some people are seeing more than that, some are seeing less. The important thing to know is that this increase was automatic. You did not have to do anything to receive it, and you do not need to call the SSA to confirm it. It should already be reflected in your payments. Now here's where things get really important and where a lot of seniors and low-income Americans need to pay very close attention. The Social Security Administration itself is going through major disruptions right now that could directly affect your ability to get help, make changes to your account, or even resolve issues with your benefits. The SSA announced it would cut its workforce from 57,000 employees down to 50,000. A reduction of about 12%, as part of the DOGE efficiency push led by the Trump administration. Now, they are calling it streamlining and reorganization. But what that actually means for you on the ground is that there are fewer people answering phones, fewer people processing your paperwork, and fewer people available to help you in person. Staffing cuts and office closures at the SSA are estimated to force seniors to make nearly 2 million additional in-person trips annually just to get the help they use to be able to get by phone. Think about what that means for someone who lives in a rural area, does not drive, or has a disability that makes travel difficult. In 31 states, more than 25% of seniors must already travel over an hour to reach their nearest SSA office. And in states like Arkansas and Wyoming, more than 40% of seniors face that kind of distance. And now there are fewer offices and fewer staff to help when you get there. DOGE's office closures have hit the Southeast the hardest, with nearly half of all closures happening in states like Georgia, Alabama, North Carolina, Mississippi, and Arkansas. In Georgia alone, 5 Social Security offices were permanently closed. One of the most significant practical changes that has rolled out in recent months involves how you can update your bank account information. As of April 14th of last year, many Social Security claimants could no longer simply verify their identity over the phone when making changes to their direct deposit. People who cannot use the SSA's online portal are now required to travel to a field office in person to make those changes. That is a big deal for people who are not comfortable with technology or who do not have reliable internet access. If your bank changes, if you open a new account, if there is any issue with your current direct deposit setup, you need to be aware that handling that over the phone may not be an option anymore. The safest thing you can do right now is set up a My Social Security account at ssa.gov if you have not already done so, because that is the fastest and most reliable way to access your information, check your benefit amount, and make changes without having to fight for an appointment. Now let's talk SNAP, because the changes to food assistance in 2026 are absolutely massive, and millions of Americans who rely on their monthly food benefits have either not been informed properly or are just now starting to feel the impact as these new rules roll out state by state throughout April and the rest of this year. The One Big Beautiful Bill Act, which passed earlier this year, will reduce SNAP funding by approximately $186 billion over 10 years, a 20% cut that marks the largest single reduction in the history of the food assistance program. Let that sink in. This is not a small tweak. This is a fundamental restructuring of the program that feeds roughly 42 million Americans every single month. The biggest changes you need to understand are around work requirements. For the first time, adults between the ages of 55 and 64, as well as adults with children older than 14, are now subject to work requirements. They must work a minimum of 20 hours a week, or they can only receive SNAP benefits for a maximum of 3 months within a 3-year period. Before this law passed, those requirements only applied to able-bodied adults without dependents between the ages of 18 and 54. That age bracket has now been extended all the way to 64, capturing a massive group of older Americans who may be between jobs, dealing with health issues that are not yet classified as fully disabling, or simply struggling to find consistent work in a difficult economy. The Center on Budget and Policy Priorities estimates that more than 1 million older adults between the ages of 55 and 64 could lose their food assistance under these new rules. And it gets more complicated. The legislation also removes long-standing exemptions that previously protected people experiencing homelessness, veterans, and individuals who aged out of foster care at age 24 or younger from these work requirements. Veterans who rely on SNAP are now expected to prove they are working or actively looking for work, or face losing their food benefits. That is a significant change that many people in those communities have not yet heard about. Researchers at the Center on Budget and Policy Priorities have pointed out that these requirements do not increase employment or earnings. They primarily just add red tape and cut people off from food assistance. Most SNAP recipients who can work already do work. And if they are not working, it is often because they lost their job and are actively looking, and they need help affording groceries in the meantime. New SNAP work requirements began rolling out in February 2026, and starting May 1, 2026, people who have received SNAP for 3 months and have not proven an exemption will start losing their benefits. That means if you or someone you know is in that situation and has not yet submitted documentation to prove they qualify for an exemption, that deadline is coming up fast. You do not want to miss it. If you have a medical condition, a disability, a caregiving responsibility, or another qualifying reason, you need to contact your state SNAP office and get that documentation submitted as quickly as possible. Many people will not lose benefits because they failed the work requirement itself. They will lose benefits because of paperwork delays, confusion, or missed deadlines. That is the real danger here, and it is something you can actually protect yourself against if you act now. The other SNAP change you need to know about involves what you can actually buy with your EBT card. The U.S. Department of Agriculture has approved waivers in a growing number of states that allow them to restrict SNAP purchases of sugary drinks, candy, energy drinks, and other items deemed non-nutritious. As of right now, 18 states have announced bans on purchasing junk food and sugary drinks with SNAP benefits. Those states include Arkansas, Colorado, Florida, Hawaii, Idaho, Indiana, Iowa, Louisiana, Missouri, Nebraska, North Dakota, Oklahoma, South Dakota, Tennessee, Texas, Utah, Virginia, and West Virginia. The specific items restricted vary by state, so what is blocked in Texas may be slightly different from what is blocked in Iowa. The best way to know exactly what applies where you live is to go directly to your state's SNAP website or call your local SNAP office. What all of this adds up to is a landscape where the people who need the most help, seniors on fixed incomes, people with disabilities, low-income families, are being asked to navigate more paperwork, more rules, more in-person appointments, and more complexity at the exact same time that the agencies meant to help them are being cut back and made harder to reach. Food insecurity among older adults has been rising over the past 2 decades, contributing to poorer diet quality, declining physical health, increased risk of cognitive impairment, and more difficult management of chronic conditions. These are not abstract statistics. These are real consequences that happen to real people when they cannot afford to eat properly. And right now, the changes being implemented across Social Security, SSDI, SSI, and SNAP are creating a level of uncertainty that many Americans on fixed incomes have never faced before. So what can you do? Stay informed. Read every notice that comes from SSA or your state's SNAP agency, because those notices contain deadlines and requirements that can directly affect whether your benefits continue uninterrupted. Set up your My Social Security account online so you're not dependent on phone access or in-person visits for routine things. If you receive SNAP and you are between 55 and 64, find out what work requirement exemptions exist in your state and whether you qualify. And if you are hearing about a stimulus check that has supposedly been confirmed and is coming in April, come back to this video, remember what you learned here, and know that the most important thing you can do is get your information from verified sources, not from viral social media posts designed to get your click and keep you watching. You deserve real answers, and that is exactly what this channel is here to give you.